morning everyone. The topic of my presentation is modified technique of using capsular tension ring in various degrees of subluxated lens. So starting with the introduction, the older technique used to be difficult. It used to cause damage to the posterior capsule or posterior dislocation of CTR and IOL, and escape of ring in the anterior chamber, rupture of anterior capsule, or maybe extension of the subluxation. So we performed a prospective interventional consecutive case series of 29 eyes of 29 patients, and subluxated cataract up to 270 degree was included in our study, while more than 270 degree of subluxation, cases of active uveitis, corneal opacity, scleral thinning, open globe injury, and retinal detachment cases were excluded from our study. Coming to the result, in our patient age group of less than 30 years were 17 patients, and between 40 to 50 age group there were 8 patients, and between 50 to 60 years there were 4 patients. In 10 patients, subluxation was less than 90 degree. In 15 cases, subluxation was between 90 to 180 degree. And in 4 cases, subluxation was between 180 to 270 degrees. And standard CTR was used in 12 cases. SUNY with a single eyelid was used in 10 cases. And SUNY with double eyelid was used in 7 cases. So for scleral fixation of a SUNY ring, firstly we bent the straight needle of double arm 10-0 polypropylene and made it curved as a modification. Another modification made by us was the use of bent curved 26 gauge needle to fetch the bent curved needle of 10-0 polypropylene suture outside the eye. The advantage of using this bent curve 26 gauge needle is that it keeps the direction of the needle tip upwards during the passage through the scleral bed into the anterior chamber so that the chances of piercing and damaging the capsular bag is very unlikely. Secondly, feeding of bent curve 10-0 needle into a bent curve 26 gauge needle becomes much easier compared to the straight needle, as shown in this diagram. So to conclude, the advantage of a modified technique is that it prevents the inadvertent escape of endocapsular ring out of the bag in the sulcus. Secondly, it avoids any stress on the anterior capsular margin, thereby preventing tear and extension of rhexis margin. Thirdly, it changes the vector force from vertically anterior-posterior to horizontally along the capsular bag, thereby reducing stress on the existing intact zonules, preventing the posterior dislocation of the capsular bag CTR complex into the vitreous cavity. Thank you.
In spite of these precautions, did you have any adverse effects in your series?
Not in these cases, sir.
No, did you? How long did you follow up these cases? Do you have follow-up of these cases?
So we have a follow-up of these cases, but it was not included in our study, the follow-up.
You used 10-0 or 9-0 problem?
As a 10-0.
Do you believe that this 10-0 will hold on for long?
So right now we have followed up these patients for at least 1 year, but no subluxation has been noted in these cases, sir, yet.
So just for your info, 9-0 will hold more,
Yeah.
and now this our Gore-Tex is available, which will hold on for good.
Oh.
Thank you.
Okay. Thank you.